building relationships and making Missoula an equitable and inclusive community. She enjoys hiking, being on the river, gardening, homebrewing, reading, and enjoying and spending time with her husband, Matt, and their two blue healers, Arthur and Penny. So it is my pleasure to introduce Sarah and go ahead and take it away, Sarah. Thank you.
Thank you so much. Thanks for having me. I'm really happy to be here today. I'm going to share my screen. Also, I just want to know I do use she, her pronouns. And yeah, I'm really excited to be here. So let's see if we can share the right screen. Okay. Can you see the slides? Okay.
Looks good, Sarah.
Okay, great. Thanks. So today I wanted to join you just to kind of give you an idea of how we've built a health equity program at Missoula Public Health and some of the learnings and uh, things that others can take from that to build their own health equity programs. So first, I just want to make sure
Yeah.
first, I just want to make sure that you all likely know the definitions for all of the things we're going to talk about, but I just want to make sure that we all have the same definition, working definitions for this presentation. So just to highlight how equality and equity are different. Equality means everyone gets the same regardless if it's needed or right for them. And then equity really considers barriers, circumstances, and conditions and gets folks what they need. This is a great example of equity we see on a daily basis. Those curb cuts really have helped not just folks who have disabilities, they really have improved access to everyone, right? So parents can pushing strollers, like kids on bicycles or scooters. So just thinking through and remembering that policies that are developed with equity in mind really do open the door for improved equity for everyone. And so when we talk about health equity, what does that mean? When we think about it in this presentation, it really is that state in which everyone has a fair and just opportunity to attain their highest level of health. To do that, it requires that we value all individuals and populations. We're really recognizing those historical injustices and providing resources according to need. And public health, the way we do that is focusing on the social determinants of health. So what are the social determinants of health? These are the non-medical factors that can affect health. And so when we think about social determinants of health, we're really thinking about the environments or conditions in the places where people are born, grow, live, work, play, age. And these include things like income, employment, workplace conditions, right? Education, access to high quality education, access to affordable and safe housing, food security, that community living and community cohesion, transportation, healthcare access, ease of access to healthcare, and then really, access to clean and healthy air and water. So thank you for letting me do just kind of a level set. I appreciate that. So just want to kind of give you a background on the coordinator for health equity position and where we've been and where we're going. So originally, Lisa Buskevich and Ellen Leahy were very forward thinking and recognized the need for a coordinator for health equity position. Originally, this position was grant funded, and through that grant, one of the goals was to build power and figure out how to build in community organizing into the health department. And what this looked like was, how do we build power and train residents on community organizing so that their lived expertise and lived experts were really the ones leading the charge on what would impact their health and well-being, and really working with them to implement or strengthen programs, plans, and policies, and build that power and agency. Additionally, the job description was really focused around a community-wide health equity plan, and being a resource for staff and managers at the department and coalitions to ensure that health equity and social determinants of health were being considered through new programming, through current programming, through new policies or new regulations. And so that was really important work. And like, again, it was housed in health promotion. And I have to give a huge shout out to Damien. He also recognized that health equity really needed to be a cross-divisional and cross-departmental position. And it wasn't that it was, at the time, I was still helping with, ensuring that we had a resource for other divisions when we talked about health equity, but really trying to look internal. And so the idea was to move health equity out of health promotion and into health administration to reflect that cross-divisional nature of the work. And so, it was important enough to the entire division that we wanted to have it across all facets. And that also included administration in those duties. And so with additional kind of research, Damien found too that other large local health departments in Montana and other states had already done or were in the process of doing what we were doing. So there was a restructure, and health administration was officially made into a division. They had already been there and been doing the work, but it was officially created as a division, and a few of the cross-divisional roles were pulled out of health promotion and placed into health administration. And so the other thing that was really important was that the department worked on securing sustainable funds for the position rather than just being grant funded. That also showed the importance of this position throughout the department. And so the last few years, we've been in transition work. And so in April of 2022, a transition plan was created and started to be implemented. Now, it took some time, right? There were a lot of coalition work that was being done. New staff onboarding was revamped during this time. We started conversations for a lived expert honorarium policy, which was a slow-moving process. We started working on a new language access and language service provider. And then another huge project began, which was the community health assessment. And so in December 2022, strategic planning was finalized. And what was really cool about that was that equity was highlighted as a core value in the strategic plan. And so we'll get back to why it's so important that equity was put into the strategic plan later on in our discussion. But in spring of 2024, work on reaccreditation for the department began. And this was huge. This really showed us that there were some things that we were doing, but we weren't documenting. And there were, our core values and our policies that we had that we needed to revise. We needed some work on really building a good foundation internally for all the programs to really highlight how equity was being and health equity was being implemented into all our programs. So we'll talk more about that soon. Again, in January of 2025, there was an updated strategic plan and work plan. And when this happened, an actual goal for equity was included. This past summer, we took on a health equity assessment that was completed and the analysis has begun. And so that's a continued process. But when you build a program, you also have to evaluate it to make sure you're heading in the right direction. So that we'll talk a lot about near the end of the discussion. And then currently we're updating the health equity job description to really reflect more about what the position is doing now versus what it was created when it was created, excuse me. So that's just kind of a overall timeline of where we're at. And so when we, through that transition period, we went to these guiding resources as we shifted the focus of the work specifically for this position. And this is really important because when reaccreditation came up to, once we started kind of finding all our documentation and examples of the work that we were doing, we recognized that there were some things that we were missing through that process. And so looking at the 10 essentials public health services and the foundational public health services, you can see equity is in the middle of the 10 essentials and equity surrounds the foundational public health services. And so really what that shows us is public health incorporates equity into everything that they do. And so how do we ensure that our staff and our department foundationally has what they need to do that? And I think that was something that was really important for us to take a look at. Like, how do we go back to the fundamentals and ensure everyone has that same foundation? And how do we strengthen that foundation and continue to strengthen that foundation? And so because staff are doing this every day and considering equity and how they provide services and what services are provided, and they're thinking about equitable enforcement as well. I think it's it was a good time to step back and reflect, like, how can we ensure that our staff have what they need, the resources they need to really do this work and consider how policies and programs will affect the community's health, and working with community partners and lived experts to improve health outcomes. So a few things that have come of this upstream thinking and really building that foundation are, we've created a glossary of health equity and social determinants of health terms. A community engagement guide was built. Accessibility and language services. We really evaluated our language services and also our digital accessibility, and we're continuing to look at our digital accessibility. And so we took on those projects as well to ensure that we have the resources that staff need to serve the community. We also had an awesome APE student that worked on a project for this health equity lens tool. And what that resource does is help staff document how they're considering health equity and social determinants of health in their programs and grant applications. So it has been used for grant applications. It's been included in the application itself. And also what's really cool is the PMQI committee is also adapting a version for us to use in our quality our quality improvement projects. I'm sorry, PMQI is performance management and quality improvement. Health equity was also considered as one of the lenses when the community health improvement plan was developed. As I stated earlier, strategic plan and calendar year work plan has had a goal added to it with 4 different objectives around health equity. We've revised and implemented an incorporation of health equity and environmental justice principles policy. We also worked with the county, and this was a slow go, and sometimes things go slow, but we have a countywide lived expert honorarium policy, and our staff was integral in building the lived expert honorarium guide that goes along with that. We had staff from different divisions involved in the development of that guide that will be a countywide guide. We've also included health equity in our workforce development and onboarding plans, and then again in performance management and quality improvement. And so one thing I did want to highlight through that is the strategic plan. And so when you're thinking about building health equity into a department, I think it's really important to get clear on what that means to the department and implement it in your strategic plan, because this is a document that guides the work that's being done throughout the department. And really why this was added is it acknowledges one of our core values. It supports our work as an accredited health department, and it also connects to our CHIP. And so there's been some really cool ways that this has been implemented. And so our strategic plan, goal number 5 is equity. So we're proactively looking for ways to reduce health disparities in our community and also increase staff understanding. So the first 2 objectives are to identify population subsets in our community that experience poor health outcomes, unique health challenges, or unmet care needs, and seek to fully understand those contributing factors, and then to design and implement collaborative strategies to change the contributing factors and improve health equity. What's been really cool about this is the coalition that has really taken this on for the strategic plan this year is the Perinatal Substance Use Network that Jacqueline Klein facilitates. And they are really, they have implemented and are using the lived expert honorarium policy in their work. They're doing community-based participatory research, and they just started their lived expert advisory group. So, or action group, excuse me. And so they're starting to do their focus groups and really working with lived experts on understanding how to better, how the community can provide better trauma-informed care, which is really cool. And I also have to shout out BRAD because he is using the lived expert honorarium policy as well in work that he's doing with the Photo Voice project that I think you all have heard about already, and hopefully we'll get an update. Looked like he was going to give a seminar later in a couple weeks too, so that's awesome. The other objective really was to administer an organization-wide equity assessment and then to provide training opportunities to staff guided by those assessment results. So the whole goal here with the strategic planning, integrating into your strategic plan really is so that the work is department-wide and it really is a focus of the entire department. And so the other thing that's really important for programs is evaluating how that program's doing, right? And so how can we ensure that what the work that we're taking on is actually impacting health outcomes? That's tricky, right? That's really hard, and we're still learning how we can do this in different ways. But a few of the things we've thought about is really building performance measures for the program and what that can look like, and also assessing our commitment, implementation, and knowledge of staff. And so for that one, there's a few different tools that we've found out there. One is pretty time intensive, but it's very extensive, and that's BARHI, and that's Bay Area Regional Health and Equities Institute, and they have come up with an assessment. Then we found one that was developed by CDC and Change Lab Solutions just recently and that's titled Health Department Assessment and Roadmap. And it takes some of the items in the bar high assessment, and it's just more digestible and easier to uh, administer. It takes less time, but it still gets you some really rich information. So we decided to use that one. And so we administered it through Microsoft Forms. It was anonymous, and there's 75 total questions, and that seems like a lot, but they're Likert scale questions. So there's five answers to each question, and then there's 15 questions in each section, and there's 5 sections. So really, the time it took staff to take this was around 10 to 15 minutes per section, maybe less. And so it only took about 30 minutes to an hour for staff to take. And so we felt like that was a really good way to get a bunch of information on how we're doing. So like I said, it has 5 sections. And so it assesses institutional commitment, staff competence, which, that was incorporated into the strategic plan, partnerships and engagement, again, in the strategic plan, right? That perinatal substance use network, and then also the work BRAD's doing, those are all partnerships, data for action, and then framing and communication. And so once this is scored, once the assessment is scored, it then helps us determine what they call stage of readiness for each of those 5 priority areas. And so those stages of readiness, you can read those: identifying and researching, empowering and engaging, formulating and developing, implementing and disseminating, evaluating and reflecting, and then sustaining and adapting. And so those levels of readiness will likely vary across the priority areas and may change over time. And what's really cool is once you determine what stage of readiness you're at, they have suggested activities at each level of readiness that can help the department determine what actions they want to take on. And so for us, we found that as an organization, we fell into the implementing and disseminating stage for 4 out of the 5 sections. And then we were in the evaluating or reflecting stage in the staff competence section. So that was really important. And then also what we did because of the assessment is we built a performance measure around it. And so that performance measure is by December 31st, 2029, MPH will increase the score on the health department assessment and roadmap by 30 points. So we're looking forward to at least getting started on selecting some of those activities so that we can start implementing some solutions to get us to those 30 points. So, things I think about for next steps and future ideas, because we're constantly learning. That is something that this role has done in the, you constantly get new information. There's better ways to do things. You're learning more from your lived experts. And so how do we ensure that we're flexible enough to reverse course, which we've done before, if we find that we need to? And so I think some of the things I think about for this role and future ideas for the department, really first is to get that job description rewritten so that we can recruit a new team member, so we can welcome a new face in and get their ideas on how to build and continue to improve the program. We need to continue to build that foundation, right? We need to implement more resources and identify staff trainings, really pushing to incorporate health equity as a lens in our performance management and quality improvement program, which is led by Anna Semple, and she's so thoughtful about it. So it's fun to think through those things with her. continuing to be that resource and thought partner with staff as new programs, plans, grants, regulations, ordinances come about. Also thinking through our own policies. You know, one of the other policies that comes to mind is our ethics policy, right? How do we ensure equity in that policy? And I think we've done a pretty good job, at least to start with the revision of that. Ensuring that we're doing the additional analysis for each priority in the assessment. Like I said, that was just kind of we've only just started the analysis on that. So what we really need to dig into is, some folks may have said, yes, we always do this. And some folks may have said, I don't know if we did this for the same question. And so really digging into those details and figuring out how we can better ensure our staff know the resources that we have and that they know how to implement those resources. Also, really figuring out how we can include community feedback incorporated into our assessment. I think too, thinking through how we incorporate more of the CHIP priority areas into our strategic planning, because that community health improvement plan and how that was developed really had a lot of that community voice included. And so I think that's a cool way to include that community voice who are saying, like, these are the health inequities that we need to look at. And continuing to partner with folks like PHC and their community organizers. So when we step back from community organizing in this role, it still was a priority for us. And so David Quattrochi is the community organizer over at PHC, and he has really been a great resource and partner for the lived expert work that we've been doing. And so making sure that connection is strong and we have that resource available. Also, continuing to partner with UM and MSU on community-based participatory research. So that Perinatal Substance Use Network, they received a grant that is a grant with UM and MSU. So that's really cool. Also, BRAD. BRAD has continued to champion lived expert work, especially in that unhoused neighbor and photo voice project. And then also providing opportunities for staff to keep building the cultural humility and safety muscles that they already have, but you don't use it, you lose it. And so reflecting on and considering biases as well, and continuing to build psychological safety, which our staff is so good at, especially in the work that they do with their coalitions. I think one other thing that I just want to mention through this work is sometimes it's hard to be the only person in the program. And it's so nice to have colleagues who are willing to think through things with you. And that's internally, but also externally, using and finding folks who are doing this work at other health departments or other at the university level, at the city, at the county. I have a really close relationship with the community access and engagement coordinator at the county. I think having those connections really help, and also having connections with community partners and community members outside. So you're still hearing that feedback that is integral into continuing to build a really strong health equity and social determinants of health program and lens to the department. I think I went a little fast, but I just want to thank you and then also open it up for questions.
Thank you, Sarah. Great job. Folks can either unmute themselves and ask a question or pop it in the chat and I'll ask it for them.
Thank you so much, Sarah. Tony, is it okay if I jump in with the first question? So you mentioned the social determinants of health, and the social determinants of health include areas vastly outside the scope of the health department. And so I'm curious, like, I know there before COVID, there was a lot of work to really engage other sectors in equity work. Um, what does that look like in Missoula, and or what could it look like? And sorry if you covered that. I had to run out for a second because my dog was barking really loud at the neighbor, and I had to go grab him and put him inside. So if you already mentioned that, I apologize. But it'd be great to hear.
Yeah, no, I think that's a great question. So, how it has looked in the past and how we continue to do that is through some coalition work. It's also through the Community Health Improvement Plan. So, one really cool thing about that plan is that the health department facilitates that and helps bring those folks together, those community partners and community members together to determine those health priorities. But we're not doing all the work. And I think that's really important piece, Damien, that you brought up is that we, as the health department, can't do all of it. And so really having those strong connections with community partners and being supportive of the work. So, for example, I'm trying to think of some things like, so mental health, right? Like there are partners who are actually leading that priority of the chip, and the health department is in support of it, and we're part of that those conversations. I think that other ways that this is being done is Lisa SPCHS does a beautiful job at through Invest Health and the work that she does through that, and also the community. I can't remember what it's called. They've changed the name. There's a community network that really is looking, that encompasses folks coming together from the city, from the county, from nonprofits like United Way, from Transvisible Montana, from the schools. And so I think making sure that the health department is part of those groups and coalitions so that we can support that work, because social determinants of health encompass everything. I mean, I've had this conversation with my dad, and he's like, yeah, if you're stressed out about paying for if you're trying to decide whether you need to pay for electricity and utilities versus food, like how stress causes, that stress of course is going to have an impact on your health. And then also if you're cold, that has an impact on your health. It's just like once you start talking about like the actual social determinants of health, people are like, oh yeah, I get that. So I think too, finding ways to involve community members in the work, but also how we communicate what health equity and social determinants of health really are, I think is a huge thing that we can work on as well. And so, yeah, being connected in those coalitions and ensuring that, I think that lived expert honorary policy really has the potential to really bring in a lot of different voices if we're able to create a space that's safe for them to come. So.
Are there similar efforts going on across the state and other health departments like there are with what you guys are doing?
Yeah. So what's also really cool, like as I was kind of finishing up, like finding colleagues who are doing the same work, Montana Public Health Institute actually convenes, kind of like sponsors, but it really is Margaret Mullins over at SPCHS who really brings us all together. It's a health equity professionals network, and through that network, people are doing the work and trying to do some of the same things, but unfortunately, they have a harder time, knowing how to communicate or this, paying people for their lived expertise is something that is challenging for all health departments. We've heard it not just statewide, but nationwide. And so there's some workarounds that folks have found going through, contracting work out and going through a nonprofit. We've done that as well before we had the lived expert honorarium policy. We would use nonprofits to pay people, or they would use money we would get to pay people. So there's workarounds, but I think that's one of the biggest barriers is how to pay people with lived expertise. And then also just with the political climate, knowing how to communicate the work to ensure that folks really understand what you're talking about, because a lot of assumptions are made.
Thank you.
Mm-hmm.
Are there any other questions for Sarah? Okay, Sarah. Well, thank you again for giving a presentation in our seminar series.
Yeah, thanks for having me. Sorry.
Yeah, just wanted to say thank you before we log off.
Yeah, wish I would have included more stuff.
Well, we have your we know where you work, so we can send you an email if there are
Yes.
follow-up questions. So
Please do. Yeah, I think that's what's really cool is sometimes it takes a long time to get the policies and the resources approved, but it's been really cool to see like being able to list out like, oh yeah, we did that too. Oh yeah, we did that too. So it's just really cool. And I think, moving forward, especially with like the community health assessment, that's another place where we're planning to use more community partners and community voice through that process when we take that back on. So that'll be really cool to see what that looks like.
we'll keep up the important work.
Yeah. Well, thank you. Thank you for all that you all do as well.
Okay. Well, let's thank Sarah virtually if we can. And thanks again, Sarah. Great job.
Yeah.
Take care.
Take care.